Kia ora koutou, everybody. The daily numbers from health are currently being finalised. They should be released shortly. We are seeing, of course, continued reasonably high numbers of cases, and the final number will be in the statement from the Ministry of Health, which will be released shortly. We have seen the outbreak continue to grow and to change over the last couple of weeks. Omicron and its transmissibility has certainly meant that we've been picking up a lot more positive cases, just as we expected and just as we saw happen overseas. But it's also important to note that this strain of the virus is causing more mild to moderate symptoms in most people, and our high vaccination rates are also playing a really positive role here. And so as case numbers have increased, what we're seeing is that we've got larger numbers of people needing to isolate and larger numbers of their household contacts also needing to isolate. The good part of that is it stops the virus being passed on, and it helps to keep our vulnerable friends and family safe, and it protects our health system. But we are also now seeing the impact that that has on other parts of our lives. It does have an impact on food supply chains, for example, and on businesses' day-to-day operations, including some critical businesses that we all rely on, like transport services. So we've been looking really closely at the advice around isolation. We previously decreased the isolation period from 14 days to 10 days, and we've done that safely based on the most recent and up-to-date advice available. The close contact exemption scheme was also introduced to play a role in helping to deal with some of these critical pressures. Today I can confirm that the isolation period for a Covid-19 case and for their household contacts will be reduced from 10 days to 7 days. This will come into effect from 11:59 p.m. on Friday. This gives us a bit of time to make the operational changes required for that, and that includes reducing the time arrivals who otherwise aren't eligible to come straight into the community. It reduces the amount of time that they would need to stay in a managed isolation or quarantine facility to match the period for domestic cases and contacts. Household contacts will need to have a rapid antigen tests at day 3 and at day 7 of their isolation period. If they become symptomatic, they should also get a test, and if the result is positive, then they're required to isolate for 7 days from the point at which they get a positive test result. If a person who is isolating at home is still showing symptoms at the end of their 7 days of isolation, they're advised to stay at home until 24 hours after they have stopped showing symptoms. That is expected to be a very, very small number of people. Everyone should report their rapid antigen test results using My COVID Record, even if it's negative, so that we can continue to understand transmission within households and how the outbreak is spreading throughout our communities. The advice that we've had also suggests, based on growing overseas evidence, that the risk of reinfection after you've had COVID-19 the first time is very low within the first 3 months after you've had Omicron. And so if someone else in your household tests positive in the 3 months after you have been a positive COVID-19 case, you won't have to go through the process of isolating again. At the moment, that period is 28 days. That's now being extended to 3 months. The settings that we've currently got under the traffic light system are playing a really important role in slowing the spread of the virus. So please continue to keep your gatherings small, wear face masks and physically distance. Finally, today I can confirm that 250,000 Novavax vaccines have arrived in the country. People are able to book these over the phone or online through Book My Vaccine from tomorrow. While Pfizer remains the preferred COVID-19 vaccine in New Zealand, Novavax is now available for people who would prefer or require an alternative. It's available to people aged 18 and over. It's a two-dose course with a 3-week gap in between them. It has not been approved for use as a booster dose at this point. People will be able to choose appointments at a more limited number of sites. Not all vaccination sites will be offering the Novavax vaccine, and more information is available on the Ministry of Health website. Happy to take your questions.
Well, because to clarify, so people are going to have to spend an extra 2 days potentially in isolation because of the bureaucracy surrounding managed isolation, like MIQ and arrivals. That's the reason that you're having to bring it in on Friday rather than immediately?
We've also got to get the law changed, and we've got to make sure that all of the systems that are designed to support people who are isolating are adapted as well. So we've got to get that out right the way through the system to make sure the system is prepared for a shorter isolation period.
Just detail sort of why now it's considered safe for people to go out and back to work after just 7 days. What sort of evidence do we see?
So we've looked at the international evidence really closely. The vast majority of infections are picked up within the first 7 days. Now, the international experience will vary. I can run you through a few of the international examples that we looked at. So we looked, for example, at a Japanese study that showed that only a small percentage, around 11% of Omicron cases, were still positive between days 7 and 9, so the vast majority were not. There was a Qatar study that showed that people with Omicron who had recently received their boosters had a much lower viral load and were less infectious. And we're getting higher booster rates in the country, so that's played a role in our decision here. Analysis of the data from New Zealand cases shows that transmission occurs most transmission occurs within households within 7 days, which is in line with a recent study from the Netherlands, for example, that shows that the majority of household cases, in this case 95%, develop symptoms within 7 days. We've also looked at other overseas studies that show that the risk of reinfection within 90 days, to back up the second part of the announcement that I made, is very low, particularly if both the original infection and the reinfection are of the same, or potential reinfection are of the same variant, the Omicron variant, which is, we are monitoring closely to see if Delta is still out there circulating. It's not being picked up hugely. So certainly Omicron is what we're dealing with in New Zealand at the moment.
Not picked up hugely. How many Delta cases are we getting at the moment?
Look, I don't have those numbers, but certainly I'm not getting reports that suggest that there's still a lot of Omicron out there. There may still be some residual Omicron cases, for example, in the people we're dealing with in hospital that were previous, but happy to get you numbers. But certainly the advice that we're getting is that we're now dealing with Omicron. We're not dealing with a dual outbreak with two variants circulating.
Where were your concerns lying as the reason to make this change? Was it the health system? Was it the supply chain issues? Where was that coming from?
The advice has changed. So obviously we've always been really clear that we'd continue to adapt our settings based on the latest advice, based on the latest information, and based on how the outbreak is tracking within New Zealand and what the overall effect of those restrictive measures are having. There is a balance here between making sure that we are continuing to keep the country functioning whilst also doing everything that we can to reasonably turn down the level of risk that we're seeing. And so we've always kept that under review. This is a relatively pragmatic decision. It does increase risk a little bit at the margins, but not in a significant way relative to the overall level of risk that we're dealing with at the moment.
The opposition parties have been calling for this for a little while. Have you been too slow to act?
I think, opposition parties tend to call for everything now, right now. As soon as they have an idea, they want to know why it hasn't immediately been done. The reality is, if you want to follow an evidence-based approach and you want to step things out in a way that is sustainable, that can be managed, then things do take a little bit of time.
From the other side of things, what would you say to people who are worried you're putting business ahead of health?
Absolutely not. So I think the evidence that I just ran through suggests that the increase in risk that we're talking about here is a marginal increase in risk. The vast majority of cases are picked up, of household infection, get picked up within that first 7-day period.
Experts were saying that Omicron tends to be more in your throat than in your nose early on, and that swabbing your throat could turn it up earlier, and anecdotally that seems to be the case. Have you received any advice on throat swabs with rapid antigen tests or anything like that?
No, I haven't. I haven't received advice on that. Of course, most of the I think all of the rapid antigen tests that have been approved for use in New Zealand at the moment are based on a nasal swab. I think there are some tests out there that use a throat swab, but I haven't received advice on those. That's probably a question for the health team. The Director General's doing this tomorrow, so it might be a good question to put to him.
Given that the settings around isolation periods, travel plans have been changing as evidence has changed, are you looking at all at changing the red light settings? Maybe gathering limits or the 100-person limit on outdoor events.
We keep everything under constant review. I don't expect to see any changes to the red light for example, in the next couple of weeks. But that's not to say that as we come down the other side of the peak that there won't be changes. In fact, I think there certainly will, but I don't envisage that being in the next few weeks.
Scope for the isolation period is moved from 10 down to 7 to move further down, or is 7 the bottom here?
What the evidence is telling us at the moment helps us to best contain the risk, whilst also balancing up the fact that we need to get people back to work as soon as they're able to. We're also seeing, we are here. I mean, this is I haven't necessarily got any data on this, but we are hearing reports of people who are recovering quite quickly from the Omicron, from being infected with Omicron, and therefore feeling ready to go back to work much earlier than 10 days.
Sorry, is that a yes then? It will be able to move down further from 7?
Not at this point.
Of underinvestment in the health system that nurses with COVID are being asked to work?
I think every health system around the world, whether it be very well resourced or not, has struggled when they've dealt with COVID-19 infection within their workforce, and New Zealand is going to be no different in that regard. What we're talking about for allowing our health workers to go back to work is that those are in extreme examples, and the types of examples that would be given there are if you're on a COVID ward, so you're dealing only with COVID positive people, you're relatively mildly symptomatic or even not symptomatic, but you had a positive test, then it may be okay to go back to work, but that'll still be the staff member's choice. They will not have to go back to work. Another example that's been given to me of where it might be justified is if you have, say, a surgeon who is the only person who can perform a particular life-saving operation, and without that person going to work, the person will die, then actually, on the balance of risk, it's better for that person to do the job that we need them to do.
Moving to another issue, which is substantially less important, the Cricket World Cup, currently you've given the tick-off for 20% of crowd capacity at those games. Why haven't you done that across the board? Why have you made that exemption just to the Cricket World Cup and not for other sports? Might that be happening soon enough?
Watch this space. We'll keep that one under review. Yeah.
Just on Novavax, how many people are you expecting to get the Novavax vaccine, and do you hope it'll boost vaccination rates in the coming weeks?
We're down to about 3% of New Zealanders adult New Zealanders eligible for vaccination who haven't had any doses at all. So I don't expect it's going to result in a massive surge. We have heard, again, anecdotal reports of people who have been vaccine hesitant, saying that they would prefer to get Novavax. It seems to be a thing that's gone around, that they would rather have Novavax. I suspect, however, reflecting earlier, people were also saying, I don't want to have Pfizer, I want to have AstraZeneca, and we approved AstraZeneca and there wasn't a huge surge in demand for that. So I suspect some of those people are saying, I don't want to be vaccinated. They're just using the unavailability of another vaccine as a reason not to be vaccinated. Having said that, the vaccine is now available, and I encourage people to take it up.
Are those vaccine hesitant running out of excuses?
Look, the vaccines are safe, and I've had it 3 times, and as everybody in this room, I suspect, has as well, and make an informed decision. But yes, vaccines are safe, and I would encourage everybody to be vaccinated.
And just are there plans to use Novavax as a booster?
They haven't. My understanding is they haven't applied to be a booster yet. But of course, MedSafe will review the evidence on that as soon as they do.
Any information on rapid antigen tests in the Chatham Islands, and is there any information on if there were to be an outbreak there, what the procedure would be to get people off the island?
No, sorry, I don't have information on the availability of tests, but I'm sure that tests will have been made available on the Chathams. But I can make sure that we check out that they have been. But I'm sure they will have been. In terms of where people are cared for, it will very much depend on whether they can isolate safely, what the level of symptoms that they're having are. If they're mildly symptomatic, then they may well be, and they can isolate safely, and they may well be left there. But if they're in need of additional care and support, they may be transferred to the mainland, and we've got good arrangements there to do that. That happens with the health system cares for people from the Chatham Islands with other things, and we're able to transfer people to the mainland if needed.
Also experiencing some supply chain issues. Is there any thought to supporting the Chatham Islands with these issues?
The whole country is experiencing supply chain issues at the moment. It's one of the reasons why we've been looking closely at everything we can do to make sure that as soon as people can safely go back to work, they're able to go back to work. And when you're dealing with the high case numbers that we are, there is going to be a supply chain disruption there. Some of those supply chain disruptions aren't just on the New Zealand side either, where it's taking a lot longer to get things into the country. Shipping lines are much slower in terms of moving goods from country to country to what we normally expect. There's been a lot of pressure on air freight. We've been doing a lot to try and alleviate that pressure on air freight because there's been that much less capacity with fewer planes flying, and so we've been subsidising some air freight, for example, to make that available. And the Chatham Islands, we'll continue to work to make sure that we're looking at whether there's a pressing need, and if there is, then we can look at that.
Just on the strain on the health system, I mean, it's immense pressure on staffing and orphan hospitals at the moment, from what I understand. Do you now regret not easing the passage to get more nurses into the country in recent years with the border restrictions?
We've had a dedicated allocation in managed isolation for health workers that has been undersubscribed for some time. We've had a border exemption to allow visa processing for health workers, again, that's been undersubscribed for some time. So some of those barriers that are perceived to have been there haven't been. So you've been able to get visas for health workers, you've been able to get guaranteed space in MIQ for them. Both of those things haven't been taken up to the extent that government's allowed for them. So if there were workers available and there were workers willing to come here, we could have got them here. But the reality is the health workforce internationally is one that's under a lot of pressure. There's a lot of demand for health workers at the moment.
Check-ins on tidings. When will the government make a decision on whether it's wider border reopenings for foreigners, for example?
As we've indicated, we've kept that under review, and I think that it is likely that you'll see some movement on the dates and bringing forward of some of those later dates. When Cabinet decides, and I don't expect that will be a long way off. I think, shall we say, by the end of the month, I'd expect that we'll be able to give much more clarity on that.
On an easing of the traffic light setting from red to orange, the Prime Minister said that is likely to occur only when after you've realised you've reached your peak, and of course cases are now out the window for assessing that. You're relying on hospitalisations, which follows 5 to 10 days after the case peak. So what I'm asking is, are you likely to make a decision to ease around that time when hospitalisations start to drop, or are you likely to move down when hospitalisations drop?
I think you're likely to see, it's one of those things that we'll look at all of the time. I think we will get a sense of what hospitalisations are likely to do post-peak from our experience at the peak in terms of the rate of hospitalisation. So as case numbers start to decline, we would expect to see a decline in hospitalisation to flow sometime after that. Having said that, of course, that's going to depend a bit on demographics as well. So even if overall case numbers are trending down, if we were to see higher infection rates amongst elderly New Zealanders, for example, then we may see hospitalisation rates, continue to put pressure on the system. So it's going to be a little more nuanced than just a simple cases go down, therefore, we start thinking about removing.
Are you open to regionalising your response? So actually moving, say, Auckland, if they come down sooner, back to orange. But
we've done regional responses in the past. I wouldn't rule it in or out, but we have done regional responses in the past where that's been justified.
Any information on how many MPs across the House have contracted the Omicron variant, or in failing that, just within the Labour Party?
No, sorry, I don't. The whips on either side are probably the people with the most up-to-date information on that. I know that it is now a number, but I don't have an accurate number on that.
Just most of the protesters have packed down in Christchurch. What's your message to those still lingering in Dunedin?
I think the message of the protest has been a very confused one, and it's ultimately not a constructive way of expressing those views either. The government's been really clear that we will only keep COVID-19 related restrictions in place for as long as they are absolutely justified. And you've seen us change the border restrictions already based on the fact that there's quite a changing risk there. The Prime Minister and I have both signalled that one of the issues that's very near and dear to the hearts of the protesters is around vaccination requirements in order to undertake certain work, or what has been now referred to as vaccine mandates. We have been clear that where it's safe to remove them, we will. But at the moment, as we're dealing with a peak, that's not the best time to be doing that. But once we're through that peak, we'll be having those conversations.
To the protesters, have they made their point, do you think?
I'm not really sure what their point was, but it's time to go home.
Police this week have said they won't be charging 2 women who were blamed for sparking that mini lockdown in Northland last October. Will you or anyone in government be apologising for suggesting that at least one of those women used false information to cross the Auckland-Northland regional boundary?
Look, those are ultimately matters for the police. We share information based on what the knowledge that we have at the time and the information that we are given at the time. I've not been given any information to suggest that any of the claims that I made at that time or information that I shared at that time was wrong. All right.
Okay, well, if we've got time. So can we just clarify then? So say you're a household contact of a case. The case isolates for 7 days. On the 7th day, your household then starts to develop symptoms. And so those people in the household have to stay for another 7 days. So it could be 14 days that the households have to isolate for.
No. So if you're a household contact, you don't need you isolate for a 7-day period. If someone else in the household subsequently tests positive for that, that doesn't restart the clock for you.
You as a household member then start to get symptomatic towards the end of that 7-day isolation.
If you have a positive test, you isolate for 7 days from the point where you've had that positive test. Yeah.
How big a factor do you think the self-isolation requirements are in people not reporting positive rapid antigen tests, for example? We've had a couple of health experts say that the true case numbers may be 3 to 5 times higher than what is officially reported.
I think it's undoubtedly true that there are more cases out there than we're seeing in the case numbers. I think there are a variety of factors. It's difficult to ascertain the extent to which that'll be people not wanting to report because they want to continue to go to work. But I do think that there is a bit of Kiwi psyche in here where there'll be people out there thinking, oh, I'm a bit achy, or oh, I've got a bit of a cold. Maybe I'll just see if it gets worse before I go and get a test. It's something that New Zealanders have done right the way through this pandemic. So my message to them is, is get the test. And get the test result. But yes, I think there is more COVID out there than the numbers are indicating.
And sort of anecdotally, we've heard of people just tossing their positive tests in the bin and being like, well, won't tell anyone about that. What do you...
If you're tossing your positive test result in the bin, then you're actually placing the health and well-being of the people around you at risk. So you're placing your workmates under a much greater degree of risk. You're potentially exposing people who you care about, who might be elderly, who might be more vulnerable. You're exposing them to much greater risk as well. So I think, the evidence that we're seeing so far is that Kiwis are overwhelmingly doing the right thing. We're seeing a good degree of negative rapid antigen test results being reported each day, which is really encouraging. And I'd encourage people to keep that up because that helps us get a sense of how much testing is going on out there if people are reporting negative tests. So, I would say to people, if you're showing symptoms, get the test, and then if you do get a positive test result, do the 7 days of isolation because it's not just about you, it's about all the people around you.
If we've just looked at your figures out, there are 19 people in ICU. At what stage, what number would you look at and go, wow, that's a real problem?
The 19 that are in ICU as of today, my understanding is that some of those people are ready to transfer onto the wards, but at the moment they're just waiting for space to become available for them.
ICU.
So the ICU aren't under enormous pressure; they're under pressure as the rest of the system is. But it's that number in itself is not a number that is causing any alarm. Of course, anyone in ICU it requires a lot of support, so the system becomes under pressure. But I wouldn't necessarily want to put a number on it. Thanks, everybody.